I would say that telehealth is not really the wave of the future. It's here and it's now. What we can do now is leaps and bounds greater than what we could have done 5 years ago. In the future, telehealth is just going to be healthcare.
As we transition to population health and to value-based care, we started to realize we have to care for patients in different ways than we have in the past, and in a more appropriate venue in many cases. And we look at trying to control costs and providing patient-focused care. Got to get into things like telehealth.
Certainly telehealth really does a lot to help improve access to care. Working with both Palmetto Care Connections and Telehealth Alliance, two statewide efforts that I think are helping to promote telehealth throughout the state to make sure that the patient gets what he or she needs and the local provider gets the support and the resources and the consultation that he or she needs.
It can be difficult for many of our patients being in a rural community to leave the community. We're at least 20 minutes to Orangeburg and about an hour to any other major referral area. So if patients have to go to Charleston or Columbia, it can be very time consuming for them, it can be very costly.
It is very difficult to recruit providers to rural areas, let alone specialty providers. So instead of bringing the providers to our rural communities, the thought is that we bring the services from the providers to our communities. So even if your providers live in larger areas, you can still infuse those services into these rural communities. So I think it is incumbent upon us to make sure that telehealth is part of today and it's part of the future. It really is going to be the future of healthcare.
Telehealth technology is just a tool, and it's a tool that we can use to solve problems that healthcare providers and patients have been experiencing for years.
The issue with heart failure is that patients need frequent appointments, frequent medication changes, frequent testing. He needs to be seen often. As much as I can be here on a frequent basis, there are times that I need to see him as his condition changes. Telehealth can help bridge that gap where I can see him a lot more often.
I have a lot of students with chronic illnesses. We have almost 99% of our student population who have Medicaid coverage. So we hope to bring telehealth here for convenient healthcare access.
Using telestroke, which is a way of video conferencing in to these remote sites with neurologists at other facilities, we have the ability to examine and treat these patients in a much shorter time frame, in a much quicker time frame where they can get the treatment they need.
Palliative care focuses on relief of suffering and to improve the quality of the patient's life.
It's a specialty that's needed, but we don't have a doctor on staff. So this service that Charleston has, if we tap into their program through telehealth, it will allow us to afford that service to our population of patients that we wouldn't otherwise be able to treat.
Well, I talked to this one lady, wonderful person. She knew exactly what I was experiencing.
I mean, they did not waste any time. They were right on the spot. They contacted me immediately. It was no delay. All I had to do was pull it up on the computer and answer the questions each day.
It was the way they talked. It was just a common effect. It meant a lot to me.
They were very kind. They were very thoughtful. They reassured me that somebody was there and could help and answer any questions you have, because it's scary. And it was good to know they were there.
We are in an area where, in order for us to get the health care that we need, we have to travel. This particular program is a much, needed resource as far as healthcare is concerned.
Being able in the future to be able to transmit that data ahead of time before the patient arrives at the emergency department, so they can be ready. The physicians can have an opportunity to review all of the data and know exactly what's about to walk in the door before it walks in the door. This has real applications to improving human lives, saving lives.